I'm Sophie Williams. I'm a Professor of Medical Engineering at the Institute of Medical and Biological Engineering at the University of Leeds. I came here to present some work that we're doing on preclinical models of surgical interventions in the hip. So that's like testing hip replacement. So why do they fail? Why do they go wrong? Why are sometimes they're not so great in patients? They are really good lots of the time, but some patients maybe don't go back to hiking or playing tennis and they'd like to. Why is that? What can we do to help them? But also looking at early interventions in the hip. So before patients might need a hip replacement because of osteoarthritis, what can we do earlier on and how can we test that in the lab and also use computational models with it?
I'm Dr. Caroline Roney. I'm a reader in computational medicine here at Queen Mary. A digital twin is a virtual representation of something. So in our case, we're looking at the heart. So we have a computer model. So we have a representation of the patient's anatomy. And then with the computer model, we can look at simulating the electrical flow in the heart or the fluid flow in the heart. And we can update the model with new data on the patient. So if we have their ECG, for example, we can calibrate the model to that and then make more new predictions on the virtual representation of a patient.
I'm Catherine Wang. I'm currently working on my startup developing a device called Lymph Motion, which is a wearable medtech device that hopefully alleviates some of the pain and swelling seen in lymphedema patients. I did biomedicine as an undergrad and I was going to do like stem cells as a PhD, but then I discovered the beauty of engineering and sort of that it was like the first time that I realized that you can use something like engineering to solve medical problems.
Hi, I'm Jane John Lewis and I'm a PhD student here at Queen Mary. I also am employed by Intuitive Surgical, where we specialise in surgical robotics. We train surgeons and their teams and we create more access opportunities for patients to receive robotic surgery. The benefits it's currently offering to surgeons through ergonomics so that we have longevity for surgeons so they're not getting burnt out and they can do more procedures in a day. And then you're also offering patients superior benefits like less blood loss, faster recovery, so they're spending less time in hospitals, which in turn enables hospitals to take in more patients.
My name is Álvaro Mata. I'm a professor in the School of Pharmacy and Chemical Engineering at the University of Nottingham. I have been working on developing biomaterials for tissue engineering and regenerative medicine. We work on different methodologies that use peptides and proteins and different biomolecules to create materials that can mimic the body, that can mimic biological environments to promote regeneration or to recreate in vivo environments in vitro to test different drugs or different therapies.